All right, we're live. Hey, the topic today is did you ever wonder why perhaps your chronic back pain is not going away, and is there a possibility that you're overlooking something, and that could be the arches of your feet? It is a very common problem, and I'm going to show you some tips and tricks today that you can do to see if your feet might be the source of your chronic back pain. You'd be amazed. There's been a lot of studies done on this showing that abnormal arches can create a lot of issues and a lot of additional stress into the low back that people overlook. Especially a lot of times when you go to orthopedic surgeons, they're just going to look at your back where it hurts at, and they're not going to look down at the foundation. But remember, the foundation, just like in any skyscraper, you build down first, right? They're digging big holes, putting big pylons down, pounding them down into the earth. Why? So that they can have a perfect structure to build on above that, which is the part that we get to see when we go to a city. And our back is no different, especially our low back. So let's talk about this and get into it. So first thing is can your arches be causing your back pain? Well, believe it or not, they can. And I'm going to show you a really easy tip to do at home right now. And so let's say that your loved one is standing in front of you, and you want to do it with socks off, ideally. And one of the things I want you to see, and this is a quick test, but it'll give you a pretty good idea, and that is you're going to take your finger and you're going to put it right here in the middle part of that person's arch. And you're going to slide it underneath of their arch, and where you want it to be is you should get to this knuckle right here. So from here in, should be able to slide underneath of that arch. That's not a good picture right there. Underneath of that arch, like that, to right there, and then you should feel resistance and it should stop. And so for the medial arch of the foot, which is the arch that we're looking at right here, this is called the medial arch of the foot. That's a normal medial arch when you're standing in gravity. So that's a quick test. If it doesn't go all the way in and it starts hitting like right here, like somewhere around your fingernail, you know that that arch, your medial arch, is getting collapsed. So that's a really fast, quick test that you can do for your family members at home to see. And if you know that those arches aren't ideal or perfect for you, that's going to typically cause hyperpronation of the foot, and I'm going to show you what that looks like and why that causes problems for us in our low back. So I want you to do that test for yourself, right now or tonight when you're with your family members. Just have them stand, no socks on, go to the middle part of the arch of the foot, try to slide your finger in, and that finger should go all the way in until it hits to this first crease right here. And when it hits that first crease, that's usually going to be a good arch. If it hits here, or you can't get it any further past that, you know you have a fallen arch. How else can you look at arches? Well, this is one of the tools that we have, and this is a digital foot scan. And what's really cool about a digital foot scan is the ones that we use here, it does two scans. It actually uses a laser, and it scans the topography of the bottom of your foot while you're standing in gravity. And that's really important because you can put someone on their back and you can have them lying on their back and get out of gravity, and their arches might look good, but as soon as you put their weight through their foot, then those arches, you're going to start seeing those collapse. And that's why this digital foot scanner is so really cool, because it lets us see what your arches are doing to support you or not support you when you're in gravity with the weight of your body going through. So when you do one of those, it does a laser scan, and then it comes back and does an optical scan, which you're seeing right here with a very bright light. And what's it do? Well, it creates an image that looks like this. So here you can see the person on foot on this side right here didn't get scanned yet, but this one did get scanned. And so that's what that scan looks like. So let's go look at it a little bit closer, and I'm going to explain to you and help you understand how to read one of these scans and how it affects your low back and how it can create low back pain for you, okay? Because it's a real thing. All right, so let's look at this for starters. First of all, you got to know what a normal scan looks like. So a normal scan looks like these right here, okay? And what do we look for in a normal scan? Well, I'm going to draw a couple of things. Number one is we're going to look at the arch that we were just talking about, and that is this arch right here. And this arch is called the medial arch. And ideally what we want to see on this is we want to see that bow inward in this direction. Okay, so we want to see a bow shape like this. And I'll show you the difference here in a minute. So that's the first arch of the foot. It's called the medial arch. It's the one that most people are most commonly, have knowledge about. The second arch of the foot and the third arch of the foot are the ones that most people don't understand. So the second arch of the foot is on the outer part of the foot, and that goes from here to here. It's called the lateral arch. And then the third arch of the foot is an arch that comes up this way, and it should make a little crescent right there. And this part up top here should look like a kidney bean. And so we want to see that on both sides. So if you see that, when you get a foot scan, you know that your arches are probably doing a pretty good job, and you're probably not hyperpronating or hypersupinating. And what would your posture look like? Well, your posture would look usually very balanced like this. So as you can see, this person over here, when all three arches are doing their job the way they're supposed to, we should have the feet should sit neutral, the knees should not internally rotate, the hips should not internally rotate, and when that happens, typically our pelvis will be very level. And that's really paramount for making sure that the low back, your low back does not have to compensate for an imbalance. So that's what we want to see. So what's an arch look like, feet look like when they are not doing their job? Well, they look more similar to this. So this person's medial arch right in here, not too bad to be honest with you. When you start seeing this bowing out like that, we know that you're really collapsing your lateral arch a lot. So this person's medial arch isn't too bad, but let's go look in their lateral arch. So from here to here, this whole area right there, remember, there's not supposed to be any red there. It's supposed to be yellow in that area. And you can see the same things happening on their left foot. So they have collapsing of their lateral arch of their foot. So this is usually a person that hypersupinates their foot. You're going to see this. And the other thing that I want you to see is look at this mid-tarsal arch. So they have a little bit of a bow right here, but when you come over to their left foot, it's almost non-existent. And so we know 2 of their 3 arches are collapsing on them. And what does that cause in our body? Well, it typically causes this, what you're seeing in this person's posture right here. You usually drop one of your arches, or both of them will start to roll in or roll out. What happens then is the knee internally rotates too much. Your pelvis will typically drop down on that same side, and now your body has to start to create this balancing act. So it's like when the guys are building the foundation of a skyscraper and they don't get it perfectly level and it's slightly tilted. 1 degree doesn't sound like a lot, but you take 1 degree and you go out 12 inches, and now it's a little bit more. And let's say you go out 50 feet, now that 1 inch is even more. You go up 2,000 feet up in the sky, and now that's a major stress for that building. Well, the same thing kind of happens to our back when our arches aren't in place. So one of the best things that I can recommend to you is that if you are having chronic back pain and nobody can give you great answers, go look at your feet and have someone who has a lot of experience and has this type of equipment to scan your feet. And I'll show you a couple other scans just to give you some ideas of what people can look like. So you can see over here in the left, this is a nice optimal scan. So remember, we talked about here, we want this arch to bow inward. That's the medial arch of the foot. That's the most common one that everyone's pretty familiar with. Number 2, green through here or yellow, but no red. And number 3, we want this crescent shape right here, and this whole top part of red should look like a kidney bean. So here's a good example of hyperpronation. Remember, we talked about when pronation happens, this arch, the medial arch, starts to bow outward, not inward like you see over here. Once we see that, where you can't get your finger underneath that arch like I showed you to begin with, you usually know that that's collapsing. If it goes into moderate pronation, it'll happen even more. Okay, and if it goes into severe pronation, you're going to have something that looks like this and just totally all red. Does that happen? Yeah, it does happen. I just had one of my clients that came and got their foot scanned a few weeks ago, and that's what they look like. So yes, it does happen. So I want you to realize that. So if you're dealing with chronic back pain and you don't know which direction to go, you're not sure, do I turn left, do I turn right? I've used taking these drugs, I did muscle relaxers, I did physical therapy, nothing's really helping me. One of the best places to start, believe it or not, is going to have your feet scanned, or have someone in your family do that test on you today or tonight, underneath the arch, bringing that finger in. Remember, that finger should go all the way to there, and that's with you standing, so all the way to this knuckle right there. Not this one though, but this one. And that's usually a really quick test that you can do to see if your medial arch is doing its job. The best thing to do is find somewhere that has a machine like this. You can go on to footlevelers.com and find doctors who have this equipment. That is their equipment, Foot Levelers. And you can learn a lot about your feet and its effect. And I'm telling you, the majority of my patients, when we get them, if they have abnormal feet and we put them in orthotics, a 30 to 35% improvement in their low back pain almost immediately. And that's a lot, right? That's a huge win for you to start to get back to your life. And then the other thing is once we have a more level foundation, there's not nearly as much stress at your sacrum and your L5 and your L4, especially if you're having bulging and herniated disc. So getting your foot scanned can really bring a lot of answers to you, and I've helped a ton of people with it. And if you need help and you're not sure what to do, go over here, book a call with me. I'd love to help you. You can go to booking.drshawnmcwilliams.com and you can get onto my calendar there, and you can fill out a form and let me know if you've been suffering with anything, what you might be dealing with. Have you had MRIs? Have you had tests? Have you had injections? Have you had ablations? Have you done muscle relaxers? Have you done physical therapy? All that kind of stuff. And that'll give me we'll have a great starting point for a great conversation. And I would love to guide you. We have a great program that you can do from the comfort of your home. And we're having awesome success with it all around the world. And we'd love for you to be the next success story. So don't give up, okay? You'd be amazed. Probably 90% of spinal conditions can be managed, believe it or not, from the comfort of your home, just with the right guidance and the right tools. And we send you everything, so you don't have to worry about a thing. You get everything that you need to get your back to be healthy. Okay, so it's we'd love to help you. So Marisa's got some great questions, and happy Wednesday to you, Marisa. What about knee and ankle pain? Well, you can feel that as well. And believe it or not, Marisa, most people don't have foot pain. I usually probably say 15% of my practice actually has foot pain. So a lot of people think, well, if I don't have foot pain, my arches should be correct, right? That is not the case, believe it or not. It's usually the opposite way. You start to lose your arches, and then they start to cause it. But believe it or not, one of the number one signs that your arches aren't doing their job for you and they're collapsing is knee pain. Because the foot is the primary shock absorber for the human body. So when we go through a process, just make sure you can see me here, sorry about that. So when we go through a process where our foot hits the ground, comes down like this, that's called pronation, without getting too scientific about it and going into all the nuances of it. That is actually how we absorb our shock. So a person who loses their arches winds up going further than that. And then when they push off their big toe and their foot comes back around and swings back, unfortunately, it can't unload all of the compression forces when we hyperpronate. And so when you go to take your next step, your joints are already under a certain amount of mechanical load stress. And this is usually what causes us a lot of issues. The other thing that will happen is that the tibia, the long bone that goes down to the foot, will internally rotate too much. It's only designed to turn in about 3 degrees. And when we lose our arches, it'll typically rotate more than that, causing a lot of pressure on the medial meniscus. And if you've had meniscus pain, not good, or had to have surgery on that. And the reason typically is because people are hyperpronating and they're not aware of it. So that's another reason to get your feet checked. So if you have knee pain, more than likely your arches are not doing their job for you. and it can be a big source of chronic low back pain for you. So please go get them checked. If you live in the Atlanta area and you would like for us to check you, we'd be happy to do that for you as well. You can just go to booking.drshawnmcwilliams.com. I'll put it back up for you one more time here. And you can schedule a call with us if you live in the area, and if not, we'd like to help you find a doctor that can go do a scan for you and help you check your feet, okay? So I hope that you, this brought some value to your life. It's something that's overlooked a lot with chronic low back pain, and if you got chronic back pain, I don't want you suffering anymore. You know, sometimes just changing a few vital components of foot mechanics, decompression, unloading the compression of your back, getting your spine to be more balanced from front to back, just like a building, makes a world of difference. And you'd be surprised sometimes at how fast you can start to feel better again and get back to your life. Marisa, another question, just full of questions today. I love it. Do people get their feet adjusted? Is that something I should do before I have for orthotics? Well, that's a great question, Marisa. So in a perfect world, if you go to a doctor or a doctor of physical therapy or a certified chiropractic extremity practitioner, someone that's actually certified in the analysis and adjustment of the human foot and ankle, I would definitely say yes. You're going to get a better orthotic, but there's only 1,000 certified chiropractic extremity practitioners in the world. Sometimes you get lucky if you live in a big city. So just keep that in mind. Is it mandatory? No, it's not. You can still get a tremendous amount of benefits from a great pair of orthotics even without getting your feet adjusted. But if you have the ability to do it, you usually will get a slightly better orthotic that will accommodate and help correct even better. So I hope you got some value from this. I love talking about stuff like this. If you got questions, I got answers for you. So either send me a direct message on Facebook if you'd like, or you can leave me a comment, tell me what you think about this. Hey, I can't tell everyone about this. I need your help. So please share this with people who might be suffering with back pain and never really thought about getting their feet checked. And if you live in the Atlanta area or you want to come see us, we would love to do it for you. We have all the equipment here. We can put it up on a big screen. I can show you where you're at. And it's an easy thing, believe it or not, to get improved. It really is. And it's not that expensive either. So what else? Trying to see if Marisa or anybody else has any questions. So yeah, it's I've been you know, orthotics are going to make a really big difference, and you can prevent a lot of issues as well by making sure your feet are neutral when you walk. So there are benefits for you even if your feet are in good shape, just to keep them that way. Okay, so I hope you'll share this. Hey, if you like this and you brought some value, I hope that I've earned the right for you to subscribe to our channel, that I'm giving you good information every single week about how to feel better and function better and get answers for yourself. Hope you'll hit the notification bell so that you know every time that we put something out, you're going to be one of the first people to actually get access to it. And subscribe to us and like us. You know, the algorithms like it when you like us. It helps us get to come and bring you more information and better information sooner and quicker. So make sure you hit the like sign, hit the notifications, and we hope that you'd like to subscribe to our channel, that we're bringing you great stuff for you and the people that you care about and love. So until next Wednesday, hope you guys have an absolutely amazing day, and I appreciate you very much. Marisa, have an amazing day too, and everyone else. Appreciate everyone joining in.